Hello and welcome to Community Helper Highlight. My name is Adam Dolce. I am the Executive Director of the United Way of Northern Chautauqua County. We are here once again to talk with one of our guests about the great work that they are doing to help the residents and citizens of the Dunkirk-Fredonia area and our entire region. Joining me today is Mike Pease, CEO of the Chautauqua Center. Mike, thanks for coming on.
Oh, thank you for inviting me.
Glad you could make it. The Chautauqua Center is doing great work and contributing directly to the health and well-being of our neighbors and our community members here in the area. They are operating both in Dunkirk and in Jamestown and taking care of everybody across Chautauqua County. So, Mike, the Chautauqua Center is a federally qualified healthcare center.
Correct.
Can you explain to us what a federally qualified healthcare center is?
Sure. So, federally qualified health centers have been around for a long time. But they are basically federally designated organizations that have to provide primary care services at a minimum. So, but there are a bunch of other requirements that come along with that. Mm-hmm. And as being funded as an FQHC, you actually get a set amount of funding each year. So, and that increases or decreases based on the number of programs you provide, the number of sites you have. So when we opened in 2013, we received a $650,000 grant to help us pay for services that included us taking care of patients who may not have insurance. Mm-hmm. So that's what that's intended to do. It's also intended to help people out who might have a high deductible, but they can't afford the full cost of that deductible. So there's a sliding scale available for people 200% of poverty or less.
So anybody's welcome at the Chautauqua Center.
Yes, we see everybody. We, regardless of insured status, we'll see you. Uninsured, we'll see you. And there are, like I said, there's a sliding scale available. In addition, we do have payment plans because we're finding a lot of individuals, even if they're insured, can't afford the cost of their high deductible. Yep. So a payment plan really helps them out. So
at the end of the day, low income, no income, whatever their status is, we want to make sure our residents in this area are healthy, and the Chautauqua Center is doing a lot to help with that. How are you different maybe than a primary care physician or traditional primary care physician?
So along with that grant funding I was talking about, there are a number of requirements that we have to follow, which includes seeing everybody, which was our intent anyways. But, you know, as you can appreciate, if we're seeing a bunch of individuals who have no insurance, there's a cost associated with that. So that grant funding covers that. In addition to agreeing to take all patients, we have to do things like case management or care coordination that a traditional primary care office wouldn't have to do. The other benefit for us as being a FQHC is we get an enhanced reimbursement rate for Medicaid patients and Medicare patients. So a traditional provider's office might not get those enhanced rates, so they can't afford to do some of the ancillary types of services that we do.
So you can go a little bit above and beyond maybe a traditional, especially for that population.
Correct. And we also do, part of that funding is intended to be used for enrollers as well. So we have enrollers on staff who can help people. And it doesn't matter what your economic status is. They can help people enroll in insurances. You know, they could be private insurance, it could be Medicaid types of insurance, managed care, all of those different things. And we'll help you. We don't pick things for any patient because that is an individual's choice, but we'll just guide them and make them aware of what's available to them.
So in addition to seeing the doctor at your office, any individual could walk into your office and sign up for insurance programs.
Absolutely.
I didn't realize it was an option.
Yep.
It's a true one-stop shop in the Chautauqua Center.
It is. And we're expanding services, so
yeah.
We're trying to do more for the community.
So you had mentioned in your last bit about care coordination. So what does care coordination consist of, and what does that look like?
So our care coordination is a little bit different than a traditional model. Traditionally, care coordination really works with patients to make sure they're going to their appointments. We take it a step farther. In fact, we are in the process right now of purchasing vehicles. We actually drive people to their appointments. We provide translation services at their appointments. And we have periodic touch points. Each person that's assigned a care coordinator, so say I'm a patient, I come to our organization, I'm assigned a care coordinator, I will get spoken to by that care coordinator X amount of time, and that's different based on the person's desire to have a care coordinator and how often they want to be contacted.
Interesting. So the transportation piece, is that, do you have to live in a certain area to access that service?
No. I'm guessing probably February-ish,
Okay.
we'll have our vehicles purchased and active. And at that point, as long as you're a patient of ours, we will transfer you and or your family to appointments, whether they're with us or a specialist.
Okay.
So, and another, I always like to share this story. Another unique thing that happened with one of our care coordinators, she transported, in her vehicle, transported a patient to Hammett for a procedure. She was Spanish speaking, and nobody at Hammett had a translator available, so they actually had our care coordinator in the operating room translating for this patient during the procedure.
Wow.
So
that is the service that most doctors' offices are not going to provide
correct.
for you. So, I mean, it doesn't matter where they live. If we've got people watching that are in Silver Creek, that are in Cassadaga, if they have an appointment at your center in Dunkirk or Jamestown, eventually, you're not quite there yet,
Right.
but eventually you'll be able to move those patients to get to you, and transportation will not be a problem.
Correct. And our intent is we'll use the existing transportation options that are available
Sure.
as much as we can, because we want to support our partners with and carts, and there's a Medicaid transportation program that the state pays for, so we encourage people to use that as well. This would be a last resort, but it's a resort that needs to be in place to make sure people can make the appointments that they need.
Sure. I mean, we know how much of a barrier so often transportation is in Chautauqua County in these rural areas. So
Absolutely.
that's an important service, and one that should be able to provide much better quality of care for a lot of people.
Yes.
That's fantastic. How many doctors and sites do you have in this area?
So we have in the Dunkirk, Fredonia area, we have our main site's at 319 Central Avenue, and then right across the street at 314 Central is our dental office. And then Dr. Preek, who many people know, joined us last December. And there's a misconception that he retired or left the area. That is not true. We're starting to advertise a lot more now. But basically, he's still providing care at the site that he was located at, and that is part of our organization now.
Yep.
So in the Dunkirk, Fredonia area, we have 3 clinical sites. And then we have another one in Jamestown. On 4th Street, but we're in the process of building a new facility in Jamestown. We're moving from a 4,000 square foot facility right now to a 75,000 square foot facility, about a couple blocks away from our existing site in Jamestown. And the intent is we will be doing the same thing in the Dunkirk area as well. Jamestown's a little bit ahead just because we were able to secure funds for that area. We're in the process of applying for funds to do the same thing in Dunkirk.
That'll be phenomenal. And I've seen some of the work. It looks like steel beams are up in Jamestown,
Yes.
so it's become very real now.
Yes.
Oh, that's fantastic. My own children go to Dr. Parikh. I went to Dr. Parikh. I was excited when he joined the Chautauqua Center and came into your family of providers. I thought that was a great move.
He is a huge asset to this community. If and when he retires, although he tells me that's not going to happen, it will be a huge loss, not just for us, but for the community in general. He has legacy families coming, and I mean, he's seeing great-grandchildren now of original patients.
Generations under that man's care.
Yes.
Yeah, absolutely. We take a look at the primary care. Now, you talked about your main site at 319 Central Avenue. It's not just 319 Central Avenue. If they walk into 319 Central Avenue, that's a big building.
Yes.
Are you just located in one area in that building?
We're located in, we prefer to call it Suite B, but it's the basement.
Yep.
Yes, if you come in, you can either take the elevator to the basement, or there are steps immediately to the right you can take to the basement. We've been in there now since 2013, and like I said, we're in the process now of actively looking for where we're going to be as we continue to grow, because quite frankly, we've grown out of that space already. But we want to take care of as many people as we can.
Sure.
So we would need to be in a bigger facility to meet that demand.
Taking a look at are all your services available in there? I guess to more of the point, if someone wants to make an appointment with a Chautauqua Center physician, is there one number they call? Is there central intake, or
Yep.
what do they do? So
in the Dunkirk area, call 363-6050. That's our main number. We actually have our call volume has increased to about 20,000 calls a month.
Wow.
So we created a call center purposely for that reason. We were getting a lot of, we had no idea we had that volume of calls. We did a little more looking into it, and we think we've addressed it appropriately by adding a call center. So anybody can call that number regardless of where they are in the county, and that will take you to our call center, and you can get an appointment at the site that's closest to you or whatever site you desire to go to. There is a Jamestown number as well, but I can't remember what that is off the top of my head.
That's okay. Our audience is pretty much North County, so that's the number that's going to matter. And it was 363-6050?
Yes.
Okay, and we'll give that out again towards the end. Is there a website that people can learn some more about your services as well?
Yep, it's www.thechautauquacenter.org.
Nice and easy.
Yep.
No, that's great. When we look at that main center right now, the 319, just primary care in that area, or are there some other services available as well?
So when we opened in 2013, we started with just primary care. We now are offering women's health services, STD testing, and obviously the appropriate treatment for that. We have behavioral health, mental health, substance abuse, counseling, and then, like I said, across the street is our dental or oral health services. And again, all of those services are available to anybody, regardless of whether you're insured or not. Payment plans. We've grown quite a bit in the last year alone. We have now on staff about 40 billable providers.
Wow.
So we hired maybe at a little more than a third of them this past year because of the demand we've been getting.
Yeah.
So
a provider, if they're a billable provider, that would mean they're a doctor, a physician's assistant. That's not counting necessarily your nurses and your support staff.
Correct. We now have, and this is countywide, so keep in mind, again, opened in 2013, had 8 staff when we opened, and we now are over 120 full-time staff.
Wow.
So we have increased quickly, and the demand just keeps coming. So.
Sure. I mean, and that's, healthcare, they say, is one of those fields that'll always be there because people will always need it.
Right.
The substance abuse side of it, I guess I wasn't fully aware that you offered substance abuse counseling right here in the city of Dunkirk and right at that location.
Yes.
Can you elaborate a little bit on maybe the behavioral health, the substance abuse, and some of those types of services and what people can expect? Sure.
So, behavioral health. The term behavioral health means something different to everybody, but basically, from the federal government's perspective, behavioral health includes both mental health services, which are your traditional psychiatry, social work counseling, those types of things, and then it also includes substance abuse. So we're doing a lot of substance abuse work right now. Of course, unfortunately, with the epidemic that's out there with people overdosing on opioids and things like that, there's a huge need. So both our primary care providers and our psychiatrists are have become certified so that they can provide like Suboxone treatment or other things like that. And again, we have a big demand in that area. Just like a lot of other organizations, there are a lot of people that need help. So we felt strongly that was the right thing to do. That's part of our job. We're governed by a community board of directors. Most of them are patients. So they see what's going on in our organization. They see what's going on in the community, and they give us guidance on where they want us to go, and it's our job to make it happen. So
you actually include patients on a board?
Yes.
That's an interesting model.
It's a requirement for federally qualified health centers. You have to have 51% of the people have to be patients. We're actually closer to almost 80% of our board members are patients or a parent of a patient, little kids.
Sure.
So that's the guidance. In fact, we just had a site survey from the federal government 2 weeks ago, and they were very impressed with how much we have done in the area of really getting our patients engaged in what's happening at our organization.
There's a lot of buy-in from that. There's got to be a lot of value and some feedback that comes from your patients that others wouldn't get.
Right, and I think that helps us a lot. Traditionally we have really good patient satisfaction surveys. Now, I'm not going to say we're perfect because we are far from perfect. Lots of things we need to do, but it really helps having patients on the board because they can identify. They come in, they see what's going on, they see how we're interacting with patients, they see, who's coming in when, and but by far the biggest issue had previously been our phone issue. That volume of calls, it was really hard for us to maintain and get back to people on the same day. That's gotten better, but a lot of that was a direct result of our patient board members saying, I call there and nobody answers the phone, or I have to leave a message and I don't get a call back. So now we have dedicated staff making sure that people are getting called back and things are being addressed.
And like you said, that was a direct result of getting feedback from people that use the services and acting on it.
Absolutely.
So very responsive. That's great to see.
Yep.
So the Chautauqua Center, if I have an issue, I have my own primary care doctor, but maybe I've got a waiting list or I can't get in to see my doctor right away for this Newsom cold that I've got right now. Is the Chautauqua Center an option to me, even though I have a primary physician?
It is. It's a little bit difficult for people that are insured, because what it requires from the patient perspective is you guys to reach out to the insurance company to let them know that you're coming to us for this one time or whatever. It involves a change to us and then obviously a change back to your existing provider. We often are hearing, I'm sick, I can't get into my doctor for 6 weeks, or can't get in for 4 weeks. That's part of the reason we exist. At our new site in Jamestown, we're actually putting in it's called Flex Care, putting in a Flex Care site where it becomes a little bit easier for patients to come and see us one time or 2 times or whatever. We'll do the same thing in Dunkirk once we have the space. That requires different space, but we don't have that right now, unfortunately, in Dunkirk. But that is an intent, and I would say half of the people who have come to us once have actually stayed. Not because they didn't like their previous provider. There's a little more. We're doing some things that a private practice can't really do. We're starting to work with it's called open scheduling, where there aren't necessarily appointments. So all of our providers have at least 4 appointments a day left open on purpose so that people can walk in.
To reduce that wait time and then having to wait to see
especially
somebody.
This time of the year.
Yeah.
I mean, our pediatric practice, and I mean, we're getting calls like crazy already about kids that are sick and they don't feel well, and I'm not a parent, but I can't imagine. I can't imagine as a parent, when your kids are sick, you'd rather take care of them than yourself, probably. So, we try to expand our services. We're looking this year at expanding the hours that we're open. So we're open a little bit later. Dr. Parikh, for anybody who has seen him, you guys know he's super accommodating anyways, but even more so now. So.
That's great. So what are the typical hours at the Chautauqua Center?
So generally our sites are open Monday through Thursday, 8 o'clock to 7.
Wow. So that's a long day.
Yep. And then we're open on Fridays, 8 to 5. And we are going to be opening in the Dunkirk-Fredonia area first, Saturday mornings, at least 8 to 12. We're actually thinking about maybe extending that to 1 or 2 o'clock. We'll see how it goes. If it's not received well by the community, we'll adjust. But, with an urgent care coming into the area, I don't know, where people will end up going when they don't feel well. But again, we're another option there where people could come to. And that is not me, saying anything one way or the other about an urgent care. They are useful. But, if you have a primary care provider, you should try really to see your primary care providers if you can.
Yeah. No broken bones in the Chautauqua Center.
Right.
That's a good place for an emergency room or maybe an urgent care to step in. But I certainly understand what you're saying there. And I think one of the nice things about the Chautauqua Center is your accessibility. The location where you are is central here in the city. With a city with a large walking population, I'm sure you get a lot of walk-up traffic and have a lot of people who depend on you being centrally located.
Yeah, we have, the last time we did, and this was probably about 6 months ago, last time we did a study, we found that about 45% of our patients walk.
Yeah.
So that's a huge number. It doesn't sound like a lot, but that's a lot.
Yeah. And how many patients do you have roughly?
So across our system, we have about 8,500 unique patients. In the Dunkirk, Fredonia area, we actually, believe it or not, even though there are less people living here, we actually have more patients in Dunkirk, Fredonia. Our site here has been open longer.
Yeah.
So we ran the numbers. It was about 4,500 of our patients are in the Dunkirk, Fredonia area.
That's a lot of people that are depending on the services and and what you perform for them.
We do get a lot of. To be fair, some of those people are like college students. We get a lot of college students coming to us because a lot of the college students, specifically at Fredonia, are not from here. So when they're sick, they tend to come to us because we'll take them. And and again, this is nothing against any private doctor's office. I think they do a phenomenal job, but it's really hard to take care of a patient that isn't really your patient.
Yeah, you're only going to see them here and there, and that's it, right?
Right.
You talked about dental services. So are you able to provide the full scope of dental services, or are there some things you can do and can't do?
We do. So we'll do, general dentistry, I call it. So we'll do the cleanings and the root planings and all of that. I know that probably doesn't mean a lot to people, but we will fill cavities. We do dentures. We'll do partials. We do minor surgeries. We won't get into anything that's too in depth.
Maybe no anesthesia.
We have anesthesia.
Okay.
So, but it's something that's really, say somebody has to have out 5 teeth or something like that. We'll refer them to our partners. We have partnerships with UB, with Dr. Menoff in Jamestown, and some of the other local surgeons. So we'll continue to see you for your primary types of dental needs, but we also we have some providers who are willing to do it, but we just haven't taken that step yet.
Sure. But it sounds like any basic dental procedure can be performed right there in the office.
Absolutely.
And dentures, I would say, is above and beyond that one. I was surprised to hear you say.
Yeah.
Interesting.
Yep. And, the last couple of weekends, we've done some free health screening events, and it has included oral health, because, the older population, a lot of people don't have dental coverage if you're Medicare age. Not because you don't want it, it's very expensive. So that's where a lot of our patients, we start to see more and more payment plans. For those patients, they do apply for sliding scale. Of course, if they qualify, they get the discount. And not only can they get the discount, they can get the discount and a payment plan. Sure. So we try to do everything we can to make sure people get the services they need.
Yeah. The other thing that's unique with you, we talked a little bit about care coordination. But there's got to be a lot of cross-referral within your system, I would imagine, with such a diversity in professional providers. Can you talk a little bit about that and the advantages of that poses? Because that's got to be a huge plus for you guys.
Sure. Actually, we've been recognized in Western New York as one of the leaders in integrated services. So basically, if you come to our organization, we've been told this by a couple of patients, actually, more than a couple. People appreciate coming to us because multiple reasons, but one of the big things they really appreciate is when they walk in the door and they check in, nobody else knows why they're there. So you walk into mental health designated site only, people know why you're going there. So unfortunately there's still a stigma that hopefully will go away at some point. But to your point, the nice thing about our organization is when you come to us for any reason, all of the providers have access to your record. So maybe you're a dental patient to start, and all of a sudden something happens, and you can't get into to your point earlier, you can't get into your primary care. Now, we won't have health records in there, but at least when the provider goes into the record, they'll be able to see your dental record. So they'll know what's been done. In our dental practice, we are collecting blood pressures, which isn't normal, but we do that. Blood pressures and some other vital signs. So at least they would have that, that data and some other things. So yeah, it's been very. We've had multiple providers come to us because of the fact that they're able to see a person's whole record rather than just pieces. So, and it really does lend itself to giving the best care to somebody.
Sure. I mean, that truly is just a team approach, especially as we see so many issues now with mental health. And I think so often a general physician is going to see issues there, I would imagine, before a person says, I'm ready to go see a professional provider. So to know that they're in the same building, again, it's got to make the patient more comfortable and make that whole process easier. So
absolutely.
Oh, that's great. There are some other things that the Chautauqua Center is involved with as well that's helping our community. What are some of the other contracted services that you're performing right now?
So we provide, it's called Eat Smart program. We're subcontracted with our Cornell Cooperative Extension out of Erie County. So we have on staff dietitians who go out and provide classes in the community. They don't work one-on-one. They do it in a group setting.
Okay.
The general belief, and that's a requirement, that's a state requirement for that program. The general belief is that way you get more, I don't want to say bang for your buck, but you get more, you're able to help more people at the same time. So that service, I don't know if that's on our I honestly don't know if that's on the schedule of when the times are is on our website or not. But if anybody's interested, again, you could call the number.
Okay. That central intake number.
Yep. Okay. You could call that number, and we can connect you. You can also, I mean, we can share emails or whatever too, and you know, that stuff. We can definitely make sure you're connected to the right people. And if you want to schedule something like that, we're open to doing that. In general, the one requirement is there has to be a portion of the group that is Medicaid level type, so 200% of poverty or less. In our area, unfortunately, that's not hard to meet.
Nope.
So really we can do, we tend to do them at the library, or we'll do them at schools, or so that's a service that's open to.
So my son's involved with Cub Scouts, and one of our requirements is we have to get a talk lined up from a dietitian. Is that a call that I can make?
Absolutely.
And see if we can line that up for the Cub Scout pack?
Absolutely.
Perfect. Making connections right here on television. That's great. But I mean, I know they've presented to classrooms. I know they've presented when I worked at Job Corps. They were a presenter at the Job Corps program.
Yep.
So anybody that's working with a group of kids, really, the information is valuable.
Yep.
And specifically, what is it looking at, and what is it breaking down and talking about?
So the program itself, and forgive me, I am not the expert at this program, but in general, it's really teaching people the right foods to select.
Okay.
Showing them how to, you know, every class is tailored to what what that group might be looking for, but teaching them how to cook things the right way, teaching them appropriate portion sizes. So it's not necessarily a diet type of program, but it really is like you should be getting your fruits and vegetables, and making good choices instead of, you know, no offense to anybody out there that likes their soda, but you know, selecting something other than select a water instead of a soda. So those types of things, you know, they encourage those things, but it's not. It's done in a way that's respectful, because you know, a lot of times when you go to a dietitian or any provider, they want to get their point across, and sometimes it can be perceived as this person's pushing me to do something I don't want to do. These are done differently because they're in a group session. It's really generalized types of information and suggestions more so than you should do X. The other thing they do is they do share a lot of recipes.
Wow.
So, you know, healthy recipes. I know our staff have actually found benefit from working with our Eat Smart people to really take advantage of that stuff.
So Eat Smart New York is an option. They can call that number, and then any group. No age requirement, right?
No,
so it could
no
be a
age requirement.
Group, it could be a kids group, could be anything in between. Can contact to get some information on healthy eating, nutritional information, and to line that up.
Absolutely.
And that's great. And the number to call there is again the 363-6050.
Yes.
Okay, wonderful. Mike, is there anything else you'd like us to know about the Chautauqua Center before we get ready to part ways here?
No, the only other thing I would say is, you know, like I said, we are far from perfect. We are trying to correct things. You know, I would encourage anybody who has an interest in, you know, wanting to help us do things in a better way, please reach out. You know, if you want to become a patient and potentially a board member, please reach out in that way as well. We're always looking for good board members. We have a phenomenal board right now, but the reality is, you know, people can only sit on a board so long, and then they want, you know, that's a lot of donated time. So we're always looking to kind of grow the next group. So again, we are here to take care of the community in a way that maybe can't be done because of financial reasons by some private providers. Yes, we do have some benefits that others don't have, but fully want that's done on purpose because we want to take care of everybody. So
great. Mike, again, you're located where in the North County?
We are at 319 Central Avenue. That's our main site. And then 1134 Central Avenue is our pediatric site. That's Dr. Parikh and his partner, Dr. Sabapathy. And then 314 Central is our oral health site. Dentist.
And the website one last time again, it's a mouthful.
It's www.thechautauquacenter.org.
Okay. Mike, thank you so much for taking the time to join us today. We really appreciate learning more about the Chautauqua Center. It truly is a one-stop shop for community wellness, and it is a real resource for the folks that live here.
Great.
So I'm hoping everybody takes advantage of the services that are here, and they'll make their way over to see if they're not feeling quite well or they're a little under the weather.
And if anybody else wanted any type of a presentation to a group or anything like that, also reach out to us. We're more than willing to talk to anybody. We just did one to a Rotary group.
No.
So...
Excellent. So there's an offer.
Yes.
I call it the meal on the microphone. Give me a meal on a microphone. I'll talk to just about anybody. But the Chautauqua Center, certainly an organization that we want everybody in our town and our area to know about because it is a real community resource.
Great.
So thank you again.
Thank you.
Just a couple quick announcements before we wrap on this segment of Community Helper Highlight. The United Way is concluding its coat drive. We will stop collecting coats probably at the end of the month. Certainly if you've got some that you find you want to drop them off, I don't think we would say no, but we're going to start to ease off the pressure. If I could pan the can around, you would see piles and piles of jackets that have taken over my office. We are very happy to announce that up to date, as of today, we've given away about 70 jackets to people in our area that have been in need. So if you are in need of a jacket, please continue to call us, reach out, get in touch with us, or talk to a service provider that you are working with and let them know that you have a need, and they will contact us and we will get it to them. So as always, thank you everybody for joining us, and we will talk to you next month. Take care. Mike, thanks again.
Thank you.
Much appreciated.